Well, how are we going to accelerate the adoption of all these new therapies into practice?
Well, I'm looking forward to this conversation to help figure it out, and actually a conversation here with all of you today. But I actually have something to say first, and that is everything I'm about to say are my opinions only and not the opinions of my firm. So now that we've gotten the disclaimer out of the way, let's get into it, Kevin.
So how do you embrace these challenges in your firm or in your investment decisions, hearing about where we are at these frontiers, AI, bioelectronic medicine, early diagnostics, genomic advances, the development of new therapies that's coming out? It seems like there's billions of people on the planet, and there's even more breakthroughs in innovation in medicine. How do you process those in terms of what's going to work, and then how are we going to actually adopt it into practice so it helps the patients and becomes valuable to the society?
You know, it's a really interesting question, Kevin, and it's not easy to do, but it's a lot of the fun that we get to have as healthcare venture capitalists. And I think we certainly start with the science, the underlying science, and speak to those investigators who are developing it, and start with what was the idea, what is the mechanism of action, have you been able to prove that? What is your sense of proof of that? And then look at the preclinical and then clinical evidence that's built over time. And so where I'm fortunate enough, I typically come in at the clinical stage in terms of making investments. And so there, we're able to look at do we have data on safety? Do we have some data, initial data on efficacy? How is durability looking in the early stages? And so we try to start with science, but that's not the only part. I think really we have to back up and say, if something is actually going to be adopted, whether it's a diagnostic or a therapeutic, it has to really be transformative. It has to make a really big difference. And I think what you were talking about, Kevin, in bioelectric medicine and some of the other types of areas that you just highlighted is that if it's a game changer, it has a chance. If it has a promising economic story, whether or not it's in the US healthcare system, at the end of the day, somebody has to pay for it, so economics have to work as well. But then I've actually been wondering about this in particular, and I'm curious what you think, Kevin, is does it really need to follow an existing care pathway that people are comfortable with? Do you go back to your training and others' training where you say, well, I learned how to diagnose and treat my patients using these steps. If I disrupt that too much, how much awareness, education, how much else has to change in order for that to ultimately be adopted? And what do we all have to do to come together to help make that happen?
I think that is the question of the day that's not being asked often enough, frankly. Yeah. I mean, one of my favorite expressions is the pioneers get the arrows, the settlers get the land. And if you're too far out in front, if you're too pioneering, one of those arrows is liable to end the whole story. And I think, last night we heard from Michael Dowling a challenge which you just raised, which is this can't be solved necessarily. If an innovation is truly innovative, if it's truly different, and in the history of medicine, that hasn't happened that many times. If it's truly different, it requires new processes, new workflows, new ways of thinking, new ways of educating, new ways of paying, new ways of buying, new ways of selling. And that's, I think that is the challenge that we're confronting right now with the rapid pace of technology and the rapid advances in medical knowledge. I think you're absolutely right. I think what you suggested or hinted at was that no one group can solve this. It can't be the inventor entrepreneur pitching to the venture capitalists, we're going to change the whole world. It can't be the AI company showing up in the health system's office and saying this thing is going to save you all this money. There's no one little piece of this that's going to work. It's going to have to be the payers, the regulators, the inventors, the clinical trialists, the practitioners, the healthcare system, and the patients. They're all going to have to come together around this, I think.
I couldn't agree more. And I think when we were speaking last night, we were envisioning what could that future be. Are there interdisciplinary teams of people that can come together at the earliest stages? And I think we might hear a little bit later today about how the FDA, of all all parties is leading some of that change. But I think that would be a really interesting model at the end of the day. If we all are centered, if you think about all of us in healthcare, what are we all doing here? Are we all trying to identify disease earlier, detect it earlier, identify new therapies? A diagnosis is only good if you have a therapy to go with it. And so, are there ways that we can come together differently? I'm actually curious, what other things are you excited about, Kevin, when it comes to the frontiers of medicine?
I would tell you, but then I'd have to kill you. I can't. We have some secrets, but what I'm excited about in the future of medicine is the fact that the nervous system is front and center now as a target of extensive research, not only in academia and in computer science, but also in developmental trajectories. I think the nervous system is the last frontier in human biology, and I think it holds secrets and opportunities for therapy that we're just scratching the surface of. But you raised another point when you mentioned the FDA, and I think it feeds in exactly to what your idea and what we're talking about of needing new groups of people coming together to work together. For too many years, decades, it's been too easy for everybody to blame the FDA. It takes too long, there's too many regulations. That's not the whole problem. That maybe it's been part of the problem historically at times, but as you just said, the FDA is taking a very aggressive stance, looking at how to streamline processes, work with companies, work with academics to make this better. It's a sign, I think, that we're at a tipping point of bringing these stakeholders all together. If you're playing golf, you may not like the rules. You may not like it if the ball goes in a sand trap and you can't hit the sand with your club until the downstroke. What a stupid rule, right? It makes it very hard to hit the ball. But that is the rule. And so the rules of our current healthcare system are that we have all these different stakeholders, and they historically have been siloed. And I think what we're talking about, you and I right now and others last night at dinner, we have to knock down those silos and work together for the good of the patients, the country, and the world.
Absolutely.
So how do we do it faster? Do we convene meetings like this? Do we pick a project? If it was in the lab, you'd get a couple of postdocs from one lab and another lab, and you'd have them do an experiment.
Well, it's actually, I've been watching some really talented entrepreneurs recently, and one I was particularly impressed with, who they had just recently received FDA approval. Small company, small amount of funding, and yet they had managed to, through their network of other academicians and researchers, actually 90 trials had been completed, investigator initiated, so it didn't cost a fortune. 90 different trials with their novel diagnostic that was actually based on reading electrical signals in the gut. And through that, they were able to start and actually launch with a broader understanding. This is beyond going out and getting a good clinical advisory board, KOLs there behind you. This was actually reaching out across the system and actually sharing their discovery and getting people to experiment with it in different ways. So that was something interesting. I think then if you take whoever you have out there that are learning and excited about your new invention, diagnostic and therapeutic, you could actually then leverage some peer-to-peer advocacy, let's call it, where they've actually done some studies on how do you get busy clinicians who have been trained in a certain way to adopt something new. And that's actually one of the more effective ways. And so if you can start with one group, where another talented entrepreneur I was just speaking with the other day said, I have a novel diagnostic where they're actually taking a fluorescent guided probe. I think a lot of people might be familiar with ICG for perfusion and nerve identification. This is actually to identify cancer. You match that with the near-infrared camera system, and it lights up cancer. So even a patient can look and say, I see that fluorescent thing, that's cancer in my body. And so if you look at that and you say, well, how do you get people to start to use that to to identify it before resection instead of some other method, you say, well, you know what, I'll train you how to do this, but I'm going to ask you to do a certain number of cases in a certain period of time. And so you get enough reps in so the training sticks, and then enough other people, perhaps in the practice, can actually say, hey, what's that thing that you're doing over there? Maybe I want to learn too. And so some of these can help once you've actually gotten to the point that it can get into humans and get out there into practice. But I've been impressed by those approaches.
Thank you, Deborah. I think we have time for some questions if anyone would like to weigh in. Tell us what else we should be doing. What could we do together or separately to solve this? How are we going to implement things faster, and cheaper, and better for our patients?
Kevin, hi. How would you advise the public if they heard you? Thank you. I'm Terry Fulmer. If they heard your presentation and they had inflammation, how would you advise them to make that next step to change their health?
Well, two things. First is the nature of your question itself feeds beautifully into the conversation, because true change at the frontiers of medicine is always driven by patients, period. It's never driven by profit. It's never driven by physicians. It's never driven by regulators. It's driven by patients demanding, and with the internet and with AI and with all the information available, that's never been more true than it is now. Patients figure out very quickly what they should do. I wrote a book about the vagus nerve. It's in production. One of the chapters is called FAQs for patients. It'll be coming out next May. I'm not going to try to sell it today. But if people ask about dealing with inflammation, it's amazingly true that the answer is the things you know already. Exercise regularly, get enough sleep, eat a balanced diet, meditate, take care of your vagus nerve, take care of having a slow heart rate, which is what your vagus nerve does do. So it's amazing that that medical advice, which much of it goes back to Hippocrates, is still where we are. I think the future, if the successes continue, as I hope they do, is that a lot of people will have chips implanted, because they prefer. We already know they prefer those over the drugs. Well, I think if there's no further questions or comments, we will wrap up. And thank you, Deborah.
Thank you, Kevin.